Speaking of that, I want to get into this statement. Chris Cuomo said, that Donald Trump is making a decision to open the doors of the United States on Easter without the support of any other expert on this matter. I'm going to take that to task right now. And believe me, we are going to go through a pretty large body that is going to show you that that's not true. Let's start with the man himself at the center of chloroquine and its use. Here's what we have from Dr. Didier Raoult, MD, PhD. He was the Director of Research Unit in Infectious and Tropical Emergent Diseases, Professor of Infectious Disease, Faculty of Medicine of Aix-Marseille University, classified among the 10 leading French researchers by the journal Nature, has over 2,000 scientific publications, has discovered over 90 new bacteria, and first discovered large-size viruses. Obviously, the guy knows what he's talking about. Chris Cuomo doesn't want to believe he's alive, but here's what he had to say, actually. From all respiratory infections, this COVID-19 is probably the easiest to treat. So there is really no reason to get excited anymore. There is really no reason to get excited and rush to produce a vaccine. Guess what? He's not alone. Next up, Dr. Frank Ulrich Montgomery, president of the German Medical Association, president of the World Doctors Federation, argues that lockdown measures, as in Italy, are unreasonable and counterproductive and should be reversed. He says Italy has imposed a lockdown and has the opposite effect. They quickly reached their capacity limits, but did not slow down the virus spread within the lockdown. A lockdown is a measure of political despair because coercive measures mean that you can go further than the generation of reason. Next, Professor Pietro Vernazza, MD, Chief Physician of Infectious Disease, St. Gallen Cantonal Hospital, found that around 85%, this is the guy, 82 to 90% of all infections occurred without anyone noticing the infection. He's the one that's saying we have a huge asymptomatic carrying body. He says, based on the new insight, we also have to understand that many of the measures that we have implemented so massively today may even be counterproductive. Next, Dr. Shukarit Bhakti, MD. I'm sure I am really beating up these names, but that's not the point. Microbiologist, former professor at Johann Gutenberg University in Mainz, former head of the Institute for Medical Microbiology and Hygiene, one of the most cited research scientists in German history. We are afraid, he says, that 1 million infections with a new virus will lead to 30 deaths per day over the next 100 days. But we do not realize that 20, 30, 40, or 100 patients positive for normal coronaviruses are already dying every day. The government's anti-COVID-19 measures are grotesque, absurd, and very dangerous. The life expectancy of millions is being shortened. The horrifying impact on the world economy threatens the existence of countless people. The consequences on medical care are profound. Already services to patients in need are reduced, operations canceled, practices empty, hospital personnel dwindling. All this will impact profoundly on our whole society. All these measures are leading to self-destruction and collective suicide based on nothing but a spook. Next, Dr. Wolfgang Wodarg, MD, German pulmonologist. This guy's gigantic, former chairman of the Parliamentary Assembly of the Council of Europe. In 2009, he called for an inquiry into alleged conflicts of interest surrounding the EU response to the swine flu pandemic. He says politicians are being courted by scientists who want to be important to get money for their institutions, scientists who just swim along in the mainstream and want their part of it. And what is missing right now is a rational way of looking at things. We should be asking questions like, how did you find out this virus was dangerous? How was it before? Didn't we have the same thing last year? Is it even something new? That's missing. Next. Dr. Joel Kettner, MD, professor of community health sciences and surgery at Manitoba University, former chief public health officer for Manitoba Province, medical director of the International Center for Infectious Diseases. I have never seen anything like this, anything anywhere near like this. I'm not talking about the pandemic because I've seen 30 of them, one every year. It is called influenza and other respiratory illness viruses. We don't always know what they are, but I've never seen this reaction, and I'm trying to understand why. Next, Dr. John Ioannidis, member of the National Academy of Medicine, professor of medicine of health research and policy of biomedical data science at Stanford University School of Medicine, professor of statistics at Stanford University School of Humanities and Sciences, director of the Stanford Prevention Research Center, and co-director of the Meta Research Innovation Center at Stanford, editor-in-chief of the European Journal of Clinical Investigation, former chairman at the Department of Hygiene and Epidemiology, the University of Ioannina School of Medicine. He says patients who have been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, selection bias may even worsen in the near future. The one situation where an entire closed population was tested was the Diamond Princess cruise ship and its quarantined passengers. The case fatality rate there was 1.0%, but this was a largely elderly population in which the death rate from COVID-19 is much higher. If we do not know about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. Hardly terrifying testimony. Dr. David Katz, MD, founding director of the Yale University Prevention Research Center. I am deeply concerned that the social, economic, and public health consequences of this near total meltdown of normal life, schools and businesses closed, gathering banned, will be long-lasting and calamitous, possibly graver than direct toll of the virus itself. The stock market will bounce back in time, but many businesses never will. The unemployment, impoverishment, and despair likely to result will be public health scourges of the first order. Next, Dr. Dan Yeaman, PhD, infectious disease modeler, former faculty member, Center of Infectious Disease Modeling Analysis, Yale University. Are you getting the picture yet? I'm going to keep going, but are you getting the picture? The actual number of people who are sick with the virus in South Korea is at least double what's being reported. So the chance of dying is at least twice as low, standing at about 0.45%, very far from the World Health Organization's global mortality figure of 3.4%. And that's already a reason for cautious optimism. We're getting there, folks. I just want to talk about, remember, Chris Cuomo just told you on primetime news, nobody supports removing or ending a quarantine or lockdown, yet every one of these scientists is telling you this is an incredible overreach. We should not be doing this. I've got a few more. Let's look at this. Here we go. This is really important because here's multiple scientists now all involved in a paper written at Science Direct. This is what they went on to conclude and say. Didier Relu being one of them. In OECD countries, the mortality rate for SARS-CoV-2, 1.3%, is not significantly different from that for common coronaviruses identified at the study hospital in France. The problem of SARS-CoV-2 is probably overestimated, as 2.6 million people die of respiratory infections each year, compared with less than 4,000 deaths for SARS-CoV-2 at the time we wrote this. And what they're saying is, look, we have always had people dying of coronaviruses. We're the experts of the world. We've been monitoring it. We've been watching it. We know it's there. It's always been within some sort of safe, acceptable region. In fact, look at this study that came out in 2006. This is fascinating. An outbreak of human coronavirus OC43 infection and serological cross-reactivity with SARS coronavirus. This is what this went on to say. We have characterized an outbreak of respiratory illness due to, remember, this is a totally different coronavirus, the HCOV OC43. The observed attack rate of 67% and case fatality rate of 8% underscore the pathogenic potential of coronaviruses in frail populations. This adds to other observations underscoring that CoVs, other than SARS-CoV, may be responsible for a broader spectrum of disease than coryza alone. These findings underscore the virulence of human CoVs in elderly populations and confirm that cross-reactivity to antibody against nucleocapsid proteins from these viruses must be considered when interpreting serologic tests for SARS-CoV. Now, this study is saying all the way back in 2006, we have a high death rate amongst the elderly with just a common coronavirus right then. You see, this has always been happening. And what we're doing is we're overly focused on an event. We just never spent time looking at it. We're overly focused on it and making a dramatic event is what it looks like these scientists are saying. It's certainly what they're saying in the study and the list I've given you. Let's look at Professor Yoram Lass, former health ministry chief of Israel, former associate dean of the Tel Aviv University Medical School. He says that the new coronavirus is less dangerous than the flu, and lockdown measures will kill more people than the virus. He adds that the numbers do not match the panic, and psychology is prevailing over science. He also notes that Italy is known for its enormous morbidity and respiratory problems, more than 3 times any other European country. He's telling you their hospitals are terrible and they are not the healthiest people. And this, one of Dr. Gutcha, founder of the Cochrane Collaboration, who has been investigating scientific fraud worldwide for decades. This is a brilliant scientist. He's published more than 75 papers in the BMJ, Lancet, Annals of Internal Medicine, and New England Journal of Medicine. All right? This guy will never want to lead anyone astray. I guarantee you he has no goal to put people in harm's way. Look what he has to say. On the 8th of March, I published in the BMJ about this. I wrote, what if the Chinese had not tested their patients for coronavirus, or there had not been any test? Would we have carried on with our lives without restrictions, not worrying about some deaths here and there among old people, which we see every winter? I think so. He goes on to say, almost everyone I talk to, lay people and colleagues, I am a specialist in internal medicine and have worked for 2 years at the Department of Infectious Diseases. All of my colleagues and friends consider the coronavirus pandemic a pandemic of panic more than anything else. The WHO estimates that an influenza season kills about 500,000 people, or about 50 times more than those who have died so far during more than 3 months of the coronavirus epidemic. Should it turn out that the epidemic wanes before long, there will be a queue of people wanting to take credit for this. And we can be damn sure draconian measures will be applied again next time. But remember the joke about tigers. Why do you blow the horn? To keep the tigers away. But there are no tigers here. There, you see? You see, Peter Gutcha is giving us a warning. He is saying we are going through draconian measures that are not warranted. We have seen this year after year after year. There are no new numbers here. But when nothing happens, they will say that it was the quarantine and the lockdown of the world that achieved this, the lack of death and disease, when we know that's going to be the case scientifically. And if we allow that to be the message and the story from mainstream media funded by pharma working on a hundreds of billion-dollar vaccine, if we let that be the story, not only will we probably be forced vaccinated, every time we have a virus in the future, every new flu season, we will have to quarantine because the numbers look very much the same. Those are the scientists around the world. They are jumping ship from what we are being told by Dr. Fauci and the CDC and the World Health Organization. Usually all of these people are aligned, but clearly somebody, somewhere, has jumped out so far ahead of this thing that these scientists have said, I'm not a lemming, I'm not walking off the cliff with you, and I'm certainly not going to risk my reputation by continuing on with what it appears from their language to be a fraud against humanity. Let's move on. How is it all of these scientists could be so sure of themselves? How is it they are putting their gigantic reputations on the line as we speak to potentially put people at risk, saying these are draconian measures and they must be stopped? They have nothing to do with stopping this illness. This illness is a nothing burger. All of them are risking their careers to say that. How could they possibly be so confident? Perhaps because they looked at China the way we did last week. Or maybe, just maybe, they're looking at the epicenter of this issue right now, which happens to be Italy. So why don't we all do that together? What is it they are looking at? Why aren't they as terrified as Andrew Cuomo, Governor Andrew Cuomo in New York is? Or, you know, Garcetti, who's about to shut down water and power on American businesses in California. What is it that they know that our leaders here do not? Well, here's the headlines we saw out of Italy just over the last couple of days and weeks. Italy coronavirus deaths pass 7,500 amid fears of spread to the south. They're overrun. Why have so many coronavirus patients died in Italy? The country's high death toll is due to an aging population, overstretched health system, and the way fatalities are reported. This is the Telegraph just saying this. We're hearing, I heard from friends. We have family members that live in the Netherlands right now, which, by the way, I believe are taking a more of a herd immunity approach and not isolating people completely. But our friends called and said, what about the deaths in Italy? People are dying like crazy. I've had friends call from the UK saying they're dying. They can't fill their beds. There's nothing they can do. And, you know, when you look, you can read. Remember, let's look at this article. One of them, it looks something like this. In Milan, intensive care to collapse for the flu. 48 seriously ill patients already, you know, are postponed operations. We're having to shut the thing down. Look at how it describes this. Record numbers, the complications of the flu, especially pneumonia, put the reanimations in crisis. 48 cases of seriously ill patients hospitalized from Christmas to today in the intensive care unit of Policlinico San Raffaele, San Gerardo of Monza, and San Matteo of Pavia. The reference hospitals in Lombardy for the use of the ECMO, the machine that replaces the lungs. You know, the problems overlap, difficulties in welcoming new patients, postponement of scheduled surgical interventions, and suspended reservations for the bedside of the resuscitations intended to welcome the sick after the operations. Extraordinary shifts for doctors and nurses called back from the holidays. It's a crisis, except what I'm reading to you came from December of, 2018. You see, what Telegraph is reporting to you is that Italy has one of the worst, most crumbling infrastructures for a health system in the industrialized world. They had a flu outbreak where 48 patients sent the whole thing into collapse, as they described it. We've known this for years. The World Health Organization has been monitoring Italy, saying this health system is terrible. They can't even handle it when they have an average-sized flu outbreak. And yet this is what we're allowing our hysteria to come from. I just wanted to point that out. But now let's get down to the numbers. When we look at the numbers in Italy, what is it that we're seeing? Now, we hear about regions, right? We hear about Lombardy and the fact that there's this huge death rate. We hear about 7,500 people, dying. But remember the article that came out? And we talked about this, 99% of all cases appear to have a comorbid event, right? There it is. 99% of those who died from virus had other illness, Italy says. Well, this week it's gone a step further. Now it's being reported that now that the health administration of Italy has gone through those deaths, what they've discovered is that 88%, take a look at this. The way in which this is what they said, the article. The way in which we code deaths in our country is very generous in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. Huge difference, with or of. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many had two or three. He says 88% of the cases really you'd have to argue died of something else. What does that do to the 7,500? You see, they haven't reduced that number. Instead, they're leaving the rest of us in a panic. I want to get to, I think I'm going to skip some of this. What do we have? The numbers? Let's look at the numbers. Let's look at the numbers as it breaks down across Italy, because what all those scientists were talking about was the average death rate we already see. So we have that broken down in total numbers of deaths in Italy. This is 2018 by region. Just to give us some perspective, right? Here it is. Lombardy. In 2018, it had nearly 100,000 people died in that year. Lazio, 57,000, 53,000. The list goes on and on and on. I think nearly 600,000 people die in Italy, a country of roughly 60 million on a yearly basis. So they have a huge death rate in Lombardy. Apparently, and Lombardy is the center of where we're hearing all of these issues with the hospitals, where the beds are overflowing. But Lombardy also has a terrible pollution problem and issues with health all the time. They have a very, very high death rate. And we've also been hearing that Italy has a much larger, older population, as many of the scientists that are backing up Donald Trump right now. They are saying that, look, you have a highly elderly population, and to make matters worse, the smoking, the level of smokers, the number of smokers in Italy is one of the highest in the world, and smoking has been directly related to complications from the coronavirus. Now, let's get down to the real numbers, though, shall we? Where do they come from? I mean, I can sit here and show you graphs and say, well, there's a huge death rate, but there is a way to actually track, is COVID-19 having an effect? Remember, we're shutting down the UK right now as we speak. Spain apparently is in dire straits. Italy is in crisis as we're seeing it. And remember, in California, they're saying, we're just behind Italy. Or in New York, you know, what's happening in Italy is going to happen here in this city. And California is saying, we're right behind New York. New York's right behind Italy. This is the way this entire thing is being discussed. But let's just take it down a notch, shall we? Let's just talk about the numbers. Let me show you the numbers that all the scientists that are speaking out now and all of these reports coming out of Italy are referencing. This is one of the things that's come from one of our investigators in Europe. This is called Momo. Let's put it on the back wall here. Oh, do I don't remember what the name is? I want to just get that right. Momo, European Monitoring of Excess Mortality for Public Health Action. Okay, so here we go. So this is a European modeling system, and you can go. We will, again, anything we show you here on the High Wire, just type ICAN into your comments right now if you're watching on Facebook. Okay, so this is right from the website. We went from the website. You can go there today. This just updated this morning, okay? And so what this is showing us right here is it's a graph. It's multiple years. If you look down here, what you'll see is it starts and it goes on a weekly basis, okay? We start in 2016, week 4, 2016, week 6. By here it's 2017, week 36, 2018, week 20, 2019. You get the idea. It's about 4 years that's being related here. Now, let's just blow out for a second, and let me show you that when you look at Europe, what's interesting is you do see, now, this red line we see here, that's the median level of death in Europe, okay? What that's saying is this is the average. So this is a constantly updated surveillance system that every week will show, are we below our average death rate or are we above it? You know, and so you have lines, you know, have 4 and 8, and you can see in Austria, it went all the way up above the 8 here. When was this? This is back in 2016, and in fact, we saw it similar. Italy experienced the same thing, very high, whatever that was. This all happened in 2016, and it happened across Europe because those countries are very close together. Whatever this was, we didn't quarantine then, right? And if you come along, another blip, this one going up above, Italy hits the top line. You get the idea. We see these rises. So this is very, very accurate information. It's what scientists use to come to their conclusion, right? So this is how the system works. Well, we went there this morning, and we just tracked Italy. So we decided, let's just look at Italy, shall we? And where are we at? And when we come over here to just this last week. Now, when we looked at this earlier in the week, we were just below this first line, and now we're just above this first line. We're not touching the top line. We're not above the top line like we were over here. We are below the top line, okay? This is what has the entire world terrorized, that this blip right here really matters, that we should be locking down the world right now. But look at other countries. If you look at England, who is now currently in lockdown, look what's happening to them. They're below that zero line. They're having less mortality right now than they had the same time last year. So is almost every other. Austria, way down. Belgium, right on the line. Estonia. I mean, I could show you the whole graph, but we're just giving you a glimpse. The only blip is right here in Italy. Well, this website also has a brilliant map feature. And so you can pull up the map and see where is the map when we look at Europe in totality. Remember, this is excess deaths. This is deaths that either goes above the average line or below it. Let's take a look at the map, shall we? Here it is. This is the day, week 11, right now, 2020. We now see a map of all of Europe. Now, I don't know if we can get close enough, but you can see how they do this. Light blue means there's no excess death, mortality taking place right now as we speak. This medium blue is above expected. It's a little bit high. And then we go to high, which is, a darker blue. Then there's very high, where we obviously are reaching some sort of critical point, right? Now, I would think, based on the news and the way that they're all covering it, that we have got to lock everybody down or grandpa will die. You're putting money before the elderly. You cannot do that. But let's look at this map, shall we? I don't know if the colors come across, but you can see that right now, all over Europe, all of Europe, for the most part, is in a no excess point right now. Not the UK, nobody. Not Spain, nobody is having some massive excessive death rate. But let's do focus. Here's Italy. And this is what I'm telling you. I'm showing you exactly what's being presented today as we speak. Last week when we looked at this was light blue. So this week the numbers are starting to come in. It's what we're seeing. It's going up. But how bad is it? This blue, I don't know if you can see it, relates to this box right here, which means they're at a high level. They're not at very high. They're at a high level. They're at a high level in the middle of what's being described as the peak of their crisis right now. It's what California is preparing for and what New York is preparing for. Their beds are overrun, but they're at a high level. Now, you might be saying, Del, you can't knock the seriousness of that. It's true. Look, there is obviously a problem going on here. But remember, there have been problems before. And we have never locked anyone down before. But let me show you how this works. How about let's go back to 2019, because you'll find this interesting. Remember this color. 2019, week 7 of 2019, last year, look what was happening there. There you have an issue that's, we have above expected, all through Europe here, and you have multiple nations that are in the high zone, exactly where Italy's at right now. These are gigantic populations and more of a problem across Europe and up into, Sweden and these areas up here, the Nordic countries. That's what I meant to say. Okay, so you could say, arguably, this looks about the same, if not worse, than where Italy's at. Italy's a little better here, but it's worse in other nations. But this didn't create a quarantine situation. We didn't lock down, all of Europe and all of the world, right? Let's take it back another year. How about let's go to 2018? Take a look at this. 2018. What is happening here? My God, we are well above high now. We have Italy in very high, very high, very high. Other nations in the high zone. A few are staying out of it. Whatever was happening week 1 in 2018, this looks horrifying compared to where we're at right now, yet still never locked down the country, never ever, destroyed our way of life and our economy. Do we have 2017? Let's see 2017. Oh my God. what was going on week 2 in 2017. Look at this. Very high, all through multiple nations. UK, others in the high zone where Italy is at right now. This must have been, what, the Great Plague? This what must have looked like the end of the world. Or was it? Remember that we are being told that, I mean, we're acting like this is what's happening, but let's go back to 2020. Remember, this is where we were back in 2017, no problem. Where are we at right now? That is where the world is shutting down at. Does anyone see an issue with that? Does anyone see a problem when we have Bill Gates describing this as the once-in-a-century pathogen? Can we see, do we have that headline? No, we don't have that headline. You can look that one up. We have tried to collect a lot of data here. But the once-in-a-century pathogen. Oh, you know what? How about we get into how these numbers work?